Good afternoon. This is Dr. Bill Wyatt again, and I'm a general dentist, but I've done nothing but orthodontics for about nearly 42 years now, and I did a lot prior to that, and during that 42 years, I've done temporal mandibular joint work where we mix together through that. And I am in the American Orthodontic Society, and I want to encourage any general or pediatric dentists that are doing orthodontics to get in the American Orthodontic Society. You really need to be in a society, and that's excellent, and it's dedicated to teaching dentists to do orthodontics, and that's what I'm in or representing here, and I hope that you'll get in there. So anyway, I'm going to talk to you some more about missing lower second bicuspids, and that's something that happens every once in a while. You don't see them every day, of course, but a real nice thing to do with them is to section the deciduous second molar, what's over the empty spot, and take out the distal half of it, and then do a pulpotomy on the medial half, and the medial half holds the teeth up that are above it and allows the 6-year molar to drift forward, which it will. So you see them early and you go in there and do that, and it may be a couple of years before you are ready to do the orthodontics. May not be anything else other than closing the space like that. So anyway, let's show you this case, and it ran past the time that I should have done it. If you look at the first video I've got on removal or using the spaces in this technique and closing the space on these kids. All right, here we go. This neat little boy, and he grows up into quite a man here, and we saw him earlier, I think in 1980. Well, this is 1989, but we saw him a couple of years earlier than this, and should have done the reduction of that tooth. Excuse me a minute. Okay, this is the models, and here it is, the missing teeth, and this is 1989, and of course that's really past the time that we should have done this to get the ability to hold those upper teeth up and let the whole thing drift forward that much. So this is the upper, no big deal. Some minor problems, but not anything big. Now here is 1987, 6th of 87, and that is when this operation should have been done. You go in and take this tooth right half in two, extract this part right here, and this from the back you go in and do a pulpotomy down in here. And when I say a pulpotomy, I'm not just pussyfooting around with a thing. I mean, we go down in that pulp and we pack zinc oxide and eugenol in there. It's mixed up so thick and blotted out so you can use an amalgam plugger and plug it into this hole right here. It doesn't matter if it's bleeding but you definitely don't blow any air in there. and you can pack the zinc oxide eugenol right on top of the blood or anything. Just pack it. It'll stop the bleeding, and it'll stay till that tooth is removed. It kills the bacteria down in there, and that, by keeping that there, this piece, the tooth is there, holds this tooth up, doesn't let it erupt into the mouth. Or if you just extract this whole tooth at this point, this tooth can drift right down in here, and then as this one starts to drift too, it'll run into it, and it can't move forward, and it'll just sit there. So if you do this right, you get this out, it'll move over here, then it holds this tooth up, then you pull this tooth, the mesial part out, and the tooth will drift right on over to this area. Just drift, you would call it driftodontics. That's what it what it really is. All right, so let's erase this. Now, this is still 1987, and it still hadn't come out, but the roots are eating off of this now, and you can't expect this to stay there by itself. And this wouldn't either, because there's not much structure holding it up. So it's kind of gone past the time to do that. So we'll have to come in, and so the baby teeth were just about all in anyway, so we come in and bracket these teeth and keep these from dropping in here while we let this tooth drift. But if we'd have done it right, these teeth would have been up here in this place right now. So you had all three of them in there. We were able to do it, but they should have done this a good bit earlier. This is 1990 now. We're finishing it up. But here's the way it works. This drifted completely in here, but if we'd have started young, we'd have had it completely drift up there and wouldn't have had to pull it in at all. Now, there's some structure in here. I don't know what's holding that tooth to keep it from coming out, or maybe we should have put some kind of a bend in the wire there that make that tooth move over in that space just a little bit. All right. Now it looks like these wisdom teeth are helplessly impacted. They would have been, but we brought all this forward, you see. This is further forward. And these wisdom teeth kind of step up and come in. We don't see them completely get there, and you don't have to. You can just, okay. Here he comes in 1996, and he has bitten this 3-to-3 retainer and kind of slid it down. I'll show it to you in the mouth in a minute. But it's still glued on here. It really stayed stuck on. So now these teeth are coming together, and this one doesn't look like it's going to have much to set on right there. So we've got all three of these up underneath. Those second bias must have been pretty big. All right, here he is. He really changed into, I mean, his masculine genes are working out in this young man. And he's a nice looking guy. I don't care for the beard all that much, but it's getting more and more popular. I don't know whether they got any more pictures. Yeah. Okay, here's 1996. 96. We've got a space open in here, and the tooth is kind of out of line. So this is January 96, and the midline's on good, but there's several of the teeth that are not perfectly lined up, and the 3 to 3 got bent down, so it kind of pulled the cuspids in a little bit. That was going on like that, you see. And you can catch these sometimes and bend them back up without popping that bond and having to rebond the wire back on there after you get it relocated and everything. So that's looking fairly decent. And this is his upper retainer that he's wearing. It's got a bite place, so the bite will never deep as long as they just wear that part time. It'll go right on along with them. Took the 3 to 3 out. You see that bar was impinging on the tissue. But we could put it back in at a later date, no problem there, but now that's the end of it. Excuse me. I want to discard those little deals. Alright, that's the end of it, and we'll stop here.